Hi, everyone. So I've got Dr. Cigdem Kipel with me today. And one of the questions that I was going to ask her, or the question that I was going to ask her, is something that I get asked about fairly frequently. So if you have a patient in the chair and you have identified that they do need to be referred to a specialist, how do you go about talking to them about this? Now, some of the frequent things that I hear is that the patient may be reluctant because of cost, or maybe their condition is not hurting them. So I thought, who else better to ask than Cigdem? So Cigdem, what are your best tips of communicating with a patient who does not want to go see a specialist?
Yeah, I think everybody has come across this where we have identified that a patient has a condition that is, for some reason or another, beyond our skill, and we think, right, it's just tipped over that threshold where we would attempt to manage it ourselves, and we're making that decision in our mind about, okay, is this beyond me now? Let's say we've made that decision. The conversation can't just jump to, you need to see a specialist, and then it's easy for them to decline that advice from you, because you haven't yet given them enough context if they decline the referral. Now, the reasons might be something that might feed our ego is if a patient says, no, I really like you and I trust you. There's part of our little soul that's like, oh, I feel so loved. But this is not about you, and that's very nice. And you can say, it matters a lot to me that you trust in my care. But part of that care is I'm actually able to determine when something is beyond my capability to give you the best care. So if someone declines, rather than saying, what should I do if they're refusing to go, I'd say, let's talk a little bit about why they preventing them declining in the first place. And I would say they're declining because you haven't yet communicated their understanding. You haven't elevated their understanding of their condition effectively enough yet. That's all it means. So if they're declining, it's not like, how do I convince you? It's, how do I explain this condition without scaring you, but get you on the same page as me, so you're seeing it from the same light. So I would, if I'm looking in, let's use oral med as an example. If I'm looking inside someone's mouth and I see a dodgy looking thing, lesion, I love that non-specific word, lesion, and we think, look, this is probably lichen planus, but I'm not, but you know what? It's not always. This is one of the things that should be checked. The way we then sit them up and explain to them what we've seen it has to be along the lines of, and I love to use analogies. Now, we have to basically say to them, there's something that I've diagnosed that I'm not skilled enough to take it further. I might not be able to do the biopsy on my own or to identify, because I don't have the experience. But I also don't want to scare them or frighten them and start threatening them with oral cancer risk, etc. You've got to be really delicate about it and really professional. So what I would start by saying is, whenever you come to the dentist, we always check the inside of your mouth for any ulcers, lumps or bumps that aren't meant to be there, and we'll always do an oral cancer screening. Now, I say those words, I don't hold back, I say it like it's normal. Now, just like the skin, if we see any funny looking moles or freckles, from time to time we will need to get some of them examined, so that we're just not concerned that anything's changing, or at least assess what the condition is. Now, because these things are not really, really common, the best person to manage from here is called an oral medicine specialist. We might see these once or twice a year, but they are seeing these every single day, and they'd be in the best position to assess it. So now you've mentioned the word oral cancer. You've mentioned you've mentioned that you're not as experienced as them, not because of a lack of your skill, but it's just statistically you're just not seeing them, and you haven't developed that sensitivity. And now they are more motivated to see. If they decline from that point onwards, after you've said it like that, we have to get to understand their barriers and leave a little bit of room for, I find dentists often guess the objection rather than ask. So they'll say, oh, it might be money, cost, distance, they love me too much and they trust me, etc. But rather than offer the specialist referral and say why they're in a better position. And if they say, oh, I think I'm good, I'd prefer not to, rather than defending your, but it's really important, but the specialist is good and they'll be fine and they're not even that expensive. Don't defend it. Just say, I'm just curious to understand your reluctance. It's sometimes awkward to ask a question because like that, because it's like a teeny bit, not confrontational, but you're like, you're making a little bit of room for honesty and some vulnerability. And you're like, may I ask your reluctance around that? Is there anything that might discourage you from, like, that's discouraging you from going? And let them tell you the answer, because it might surprise you and it's often different to what you think. It might not just be about money. Don't assume that it is. It might not just be about because of the fact that they love you, even though you want to think that. It could be something else, and you can address it that way. So if it is something about money, if they say, oh, look, I don't want to see because I can't afford it. First of all, they don't even know how much it costs. And I say, well, that's a really good, it's normal to be concerned about costs. So what I would suggest you do is, so that you know what the process is, how about, we inquire as to what the fee would be to have an assessment, say, because everything now is just about risk. Chances are everything will be okay and you might be able to manage this and get the confirmation that's all clear. However, in the unlikely event that it's something that needs further investigation, it's something that I'm sure those who have had a negative diagnosis would wish that they attended it in a timely manner. Would you like us to at least inquire about the cost before you go ahead? And I'm sure it's not, you don't have a fee that's going to force them to remortgage their home, but certainly the cost to them, if there was a diagnosis that was different, they would absolutely want to know. That's the most expensive thing they could do. That's specific to oral surgery. Yeah.
One of the things that sometimes I get asked is the general dentist wanting to know how much the consultation will cost, which I don't mind telling, because our costs are in line with everyone else, with every specialist, really. So is discussion of how much the specialist is going to cost, do you think the general dentist should get into that? Because I don't mind the dentist knowing, but what I can feel, what will probably happen sometimes is that they don't. First of all, you have to give a range, because you never know what the specialist is going to do, because it could be a consultation plus a biopsy in terms of oral med, or it could be other things on top of that. So do you think that the general dentist should be discussing costs in detail about this? No,
I don't. I really don't, because I would only raise it. I would only open it up if they identified it as a specific barrier. I would not lead with that. It is not, because it's very presumptive to assume that that's their primary thought about it. And it's also, I don't want it to detract from the reason for the referral, which is about diagnosing a condition, a condition which has consequences, and the consequences may have far more costs, not just financial, but biological costs in other ways. So I don't want to dilute my message by bringing up costs. Now, if it comes up, of course, you can say, rather than declining because of costs, perhaps you can inquire and just see what a consultation would be, and they can take it from there. Now, if you saw a patient and upon first glance, and say your consultation, let's just say it was $200. Let's say you looked at in their lesion and you just had that oral medicine gut feeling from experience that this is dodgy. This is not going to be a good diagnosis.
And it happens.
I very much doubt you would struggle to communicate the need for further investigation, biopsy, etc. once they have understanding. It's all about understanding. If they decline, it's just you haven't done a good enough job elevating their understanding of the condition and the consequence of that condition. Just talk only about the condition, the consequences, the risk, rather than pushing specialist fees. Don't worry about the practical side, because you are not, I always say this, I heard it said to me, you don't own their problem. It is their responsibility as an adult to go to the specialist, and you're there to support them and guide them. But you don't need to own the problem by talking about their fees and trying to that's just a practical adult responsibility that they need to have. It's a little bit different. I mean, look, I've used the example of oral med and a potential risk for something very serious like oral cancer. But it also could be something like a referral to a pediatric specialist or a referral to an endodontist, just because you don't do a lot of endo, perhaps. I always start by deciding first in my head that I'm going to refer. Say, right, it's crossed my threshold of something I want to do or I'm comfortable with. Sitting up and talking first and only about the condition and the consequences of the condition. And I put a layer on it, like these things can be complicated. They are not that common. I don't see a lot of cases here myself frequently enough to be able to recognize these things. There are people that do nothing but complicated root canal therapies that look just like this one, and in their hands, because of their skill, expertise and their equipment or whatever, I'll use whatever, they're in the best position to get the best outcome. And I still leave it to them as a choice, but I make it so like I can, of course, like it is possible, but the best approach from here is to see a specialist. So I'd like to refer you to blah, 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 blah. And I don't make it about the cost or the practicality. I just make it about the outcome and the condition. Yeah. I actually very frequently, I don't see a lot of kids. So my thresholds for like referring for, if I needed to do an occlusal filling, I'd refer to a pediatric. That's why I don't see any kids anymore, but I elevate the position of the specialist a lot in my communication. I say they are doing nothing but this. They are going to be the best people to give a great outcome. Yeah. Sorry to keep talking, but I wanted to finish the second part of that question, which is like, let's say you've done all the right things, you've communicated the consequence, you've said, look, in my hands, it's not going to work. And they still say, like, I don't want to see a specialist. And then you've asked them to elaborate and give them their thinking, and you want to really understand their position about why they've said that. And they've said something and they still don't want to see the specialist. At that point, it's now about informed consent. It's purely now about informed consent, that they are making a decision against your advice. And you can say, look, at the end of the day, of course I can't force you, but it is you don't have to see them yourself to do that treatment. You don't have to, if it's a really complex root treatment, you're like, you should see a specialist, and they say, no, I'd decline. You don't have to give them the alternative that you'll do it. You can say, I'm not, it's not something that I would typically do here. So now they're stuck. Now they're like, specialist, or I know you're not going to do it. You need to keep their mind focused on the condition, and you need to actually say the words like, you can lose this tooth, you can extract it, here's a picture of someone else who's had a condition like yours, some of them result in this, etc. But still, if they decline, it's just about informed consent and saying, at the end of the day, it's still, of course, entirely up to you what you'd like to do. If you do choose not to go ahead, we've got to be really mindful of the consequences of this. If this happens, please contact the specialist, us or something immediately, because now this is a real risk. So they need to walk away with that. I have to say that almost never happens. Like you'll rarely ever get to that point. And if you're frequently having patients declining specialist service, it's probably because you need to work on that initial communication first.
Yeah. I agree with you. I don't think it happens very often when someone has done everything that they could and they still decline. And in the rare case that does happen, I think the dentist has done their job perfectly. They've explained to the patient, they've educated the patient, and then it's up to the patient at that stage if they still decline. Yeah, no, definitely agree with you. All right, great. So thank you so much.